the head of the humerus. This is the head. I'll just brief you first, then I tell you. This is the head. This is the upper end of the femur, lower end of the femur. Don't hold it like this. Don't hold it like this. It is the longest bone in the body, human body. It has a upper end, that is the head, and single globular head, single globular head, single globular head, single globular head, single globular head. Because why I'm telling you these two lower condiles, you might take it like this. It happens, it happens. It happened to us also. ভাবিস না ওইরকমই ছিলাম। Now, don't, মানে ফার্স্ট হচ্ছে তুমি যখনই এরকম হয়ে গেলে না, তখন examiner won't say, hey, what you are doing this? Hey, they won't irritate you. But your first presentation will give a signal to the examiner. Okay. Now, if you have written or you have read or you have seen the bones slowly. Now, this is the upper end. This is the upper end of the thing. This is the concave surface anteriorly, a convex surface anteriorly, convex surface anteriorly. Convex surface anteriorly. Now, there are two condiles. That is the lower end, which articulates with the tibia, upper end of tibia, lower end of femur, and upper end of tibia to form the knee joint. The lower end of femur articulates with the upper end of the tibia to form the knee joint. Okay. Now, the convex surface anteriorly, convex surface posteriorly. And you see the shaft of the humerus. It is having a ridge that is known as the linea aspera, that continues up to this portion, this portion. This is the condyle. Now, you can see these portions. This is the synovial membrane is in relation with this. Now, one thing I tell you, you have read the superior extremity. Superior extremity হয়ে গেছে, গল্প হয়ে গেছে. It's a story now. Superior extremity, keep the khata there. Aram, aram. Nehru used to say, aram haram hai. Now, one thing I tell you, now these two surfaces, they form the knee joint. Now, the hip bone, this is the hip bone, and this is the socket. Now, you tell me, from your superior extremity, the humerus and the shoulder joint, what do you relate? Which joint is stable and which joint is unstable? Which one? The name of the joint. Hip. বল, ঠিক আছে। এবার কথা হচ্ছে যে why? You have seen a game of football, you played football, you will have your in the trophy match and all this. Now, do you Have you seen Ronaldo kicking? The thing he kicks like this, but his hip joint doesn't go up. But shoulder joint is unstable. It can be dislocated easily because of the shallow granodal cavity and the humerus head. Now, have you seen salsa dance? Now you see how they move and this thing. This one dance I could not do, but the rest in our school we used to have dances and in Asansol, Loreto House, the girls were there, and St. Vincent's boys were there. We used to have socials, the annual at least 2 or 3 charity to collect money for Mother Teresa. Okay, naturally, and your technical students, they were a bit rough and tough, though we were loved by the Loreto House girls. So there was a competition between the St. Vincent's and St. Pat's boys. Now, I'm telling you that you just see the acrobatics. This winter, if you are going to Kolkata, or you see in your mobile, যে একটা সালসা ডান্স ওর যেমন মাথা কাজ করছে না, এটা দেখে নিলে, তখন কিন্তু তুমি অ্যানাটমি পড়ে নিলে। And you can see how the flexibility of the total body. See a trapeze in a circus. And that time see Ronaldo's hip, your femur chala gaya, or the ball doesn't go into the net. Now, with this basic perception, I'm telling you one thing. One by one it will be taught to you. Let's see the cavity. And okay, now you must not forget, because see, one thing, if you are very confident when you are giving the viva, even you pick up this bone, you have lots of things to answer. No, like in this this terminal semester, first semester or something. So না এটা পড়িনি, তোমরা আমাদের পরীক্ষা দেবে, there will be no external. Okay, so this is a testing ground. Don't feel shy, but don't say no, এটা দিয়ে পড়েছো না, এটা পড়েছো, তাহলে পড়েছোটা কি? তোমাকে সব পড়তে হবে, মেইন থিং, মেইন 4-5টা। আমাকে যদি বলো যে একবারে ডিটেল অ্যানাটমিটা বলতে, genicular arteries, where the arterial dorsal space goes into this, I don't know how much I'll perform. So you have to recognize, don't make a femur, say femur, don't say humerus. This is one main thing. Your side determination, right and left, right and left, right and left. This have it in your head. Main key points. Now one thing is this. See, this is the articular surface. This is cartilage is there, semilunar cartilage over here. And this is fovea. This fovea will be medially. It won't be like this. because this fovea has a small ligament and then goes in the shape of Y and gets in the margin of the acetabular cavity. See, this is empty. Underneath the vessels go. It's like a flap. Okay. Now this is the main things. The posterior surface. This is the now this is the lower end. This is the popliteal surface. The popliteal muscles. These are muscles are there anterior of the thigh. You see the muscles. Okay. Now the greater trochanter, lesser trochanter. Now fractured neck of the femur. If it goes through in the subtrochanteric line, then you put a plate and screw. But if this only partial, it can be total fracture of the neck of the femur or partial. So, hip replacement that is one thing. Now, Yodin Ulberia, okay. Now, he attends one clinic, immediately X-ray. Even you don't have an X-ray, then you will see if a fractured neck in the femur, then your like this, it will be like this. Your foot will be like this. And you will see in any clinical textbook, that is, but K. Das, his son is editing that. That was such a good book. It is still a good book of clinical medicine, surgery or your clinical. Now, you see this. When I was quite young, when I used to come home, and I had to see my father plastering. These things used to be plastered. Nowadays, you have hip surgery, whole hip replacement, and whatnot, robotics. Then, after 7 days, you start with a walker like this. But I'll tell you, if there is a small fractures that I encountered, there was no this C-arm X-ray or your orthopedics practice that is going on now throughout the globe is plate, screw, prosthesis, all this. Now, you just have to take a foot scale, rulers, the wooden. If you don't get anything, then you take a cardboard, hard cardboard. Then you fold it like at this, 2-3 folds. You place it in the sole. You have to put it in the sole like this. You place it like this. It is like this. Okay. And tie a bandage around the ankle and make it fixed. Ambulance, send it. Even in today, it is effective. That means each time it moves, stretcher boy aayega, Apollo Hospital, he is doing khoini. By the time it is delayed, more movement, more distortion, more chaos, more he is suffering from pain and once the stretcher, from the ambulance stretcher to the your bed, all this process will traumatize that area. So it happens that neurovascular this thing will be distorted in full. I have a bad throat today. Now, then that gives a comfort zone for that patient. Okay. Now you have to, I told you that this is the most stable joint and your shoulder joint is unstable because of the shallow glenoidal cavity. Shallow glenoidal cavity and But here you see, you have seen please do you see এবার নিজেরা শুরু করো বেসিক্স গুলো বলে দিলাম ইউ হ্যাভ টু নাও রিলেট আমি বলি তোমাদের তোমরা এখানেই থাকবে দেখবে বই খোলো বই খোলো বই খোলো ট্যাব খোলো যা আছে হ্যাঁ আমাকে দেখি লাভ নেই কার বই একে দত্তা A.K. Datta, Professor A.K. Datta, I had my first Anatomical Society paper presentation in Jammu in 1981. I was a student that time. I was in 4th year or something like that. So he taught me how to present the paper and the dais. And he was very close to me. And anyway, there were known as the yellow notes of Samar Mitra and A.K. Datta, yellow notes. That was a cyclostyle machine was there. Means, you type it and that machine you make a typed notes, cyclostyle typed notes. When you read the main features, the trochanteric fossa, what muscle goes in? The lines, major lines. What are the muscles attachment? Now, this, bolo? Linea Aspera. Now, there are muscles of the adductor group. Now, when you are describing like this, hold it like this. When you are describing, so these muscles from medial to lateral. One thing from day one, you either describe in the attachment of the linea aspera, you from medial to lateral or lateral to medial, whichever you are comfortable. Stick to one. You have to be very calculative. তোমাকে চুরি করতে বলছি না, but you have to be calculative because you have to orient your brain and see from medial to lateral. 1, 2, 3, ratto. When you read amongst a group in your 10 p.m. to maximum 11:30, 12. But তারপর ঘুমিয়ে যাবে sleep cycle you don't take it to up to 2 a.m. Yes, first class miss, second class miss, আর ফোন করছে তোমার গার্লফ্রেন্ড ফোন করছে এর ক্লাস আসিস নি কেন হ্যাঁ তখন তুমি বলবে যে ঘুমিয়ে গেছিলাম ঠিক আছে না দেখো আমাদের একজন মাস্টারমশাই ছিলেন প্রফেসর উই হ্যাড Professor Nitai Chakraborty, a wonderful teacher. He used to talk like this. So, kichu to guru shishyo parampara. I have to take in, and you are my parampara.